Hi, listeners.
Hello. Welcome to the MedInsights Unleashed podcast.
With your hosts,
Z.
and John.
Hi, John. Good morning. How are you?
Good morning to you, Zahra. Really ecstatic and excited about our first episode of the podcast. So I'm absolutely over the moon.
Me too. John and I have been working tirelessly to get to this point. So I'm very excited as well. And I think it'd be great for the listeners to get a better understanding as to who is John Collins, who is Z, and how did you and I actually come together to co-develop this podcast? So John, I'm going to kick it over to you. Who's John Collins?
So John Collins is been in the pharmaceutical industry for 35 years, and my expertise lies in international global marketing strategy, business development, and business research. In that time, I just want to give a big shout out not only to the listeners on this program today, but also to all the surgeons, medical oncologists, physicians, intensivists that have, and the teams of people that I've worked with over those years, because without them, I wouldn't be here today talking to the listeners and have that knowledge that I've gained from those people all this time.
Yeah, we've both had some great mentors throughout our career. And who is Z? Well, I'm a clinical trial nurse by training within the area of gastroenterology. And over the past 2 decades, I've actually been working within the pharmaceutical industry with a specific area of interest of mine is within oncology. And John, that's actually how you and I came together, where we met at the previous pharmaceutical company that we were both at.
Yeah, I was the vice president, global lead for a product that covered liver cancer. And that's how I met Z, who was the medical director. And we were working together launching this product around the globe.
Yeah. And, that's where we were having these great conversations with healthcare specialists at various meetings and conferences. And John, you and I would be discussing the latest clinical data, and we'd walk away thinking, this is so important and valuable. And how do we get this to the patient? Because that's where our passion lies, whereby we're working or trying to help improve patients' lives and ultimately make that difference.
I don't know if people understand that liver cancer is a very underserved disease. Over 870,000 patients a year are diagnosed with liver cancer, but more importantly, 765,000 patients die a year because of this disease. So it's been really an underserved area and a gap that we see importantly to fill. There's a term that I use called filling the void. We'd like to fill the void that happens between the physicians and the patient.
And John, that term, filling the void, is, as you shared with me earlier, it's something that you have or that you discovered or you utilize within EMS. Did you just want to elaborate a little bit on that?
Yes, other than becoming an international marketer, due to my son, we in New Jersey volunteer a lot, mainly in the fire department EMS. So I'm a volunteer EMS first responder, a crew chief actually. And in that time, those 18 years, we get to see a lot, unfortunately. And being a crew chief, one of the areas that we have to work extremely rapidly in is patients with major trauma. And blood, we all know, is the life source. We need to fill where there's significant trauma and blood loss. We need to fill that void very, very quickly. And to me, knowledge is the void. Knowledge is all. There's the gap, which is the void. And from my passion and Zara's passion is we want to fill that void as quickly as possible. So the listeners know where I live, right? Which is in New Jersey. So Zahra, where do you live?
Yeah, so John, thanks. I'm actually in Canada. I'm on the west coast in a small town called Seashell, which is on Vancouver coast, and I'm surrounded by mother nature and water, and it's absolutely very peaceful. So John, we've now recorded our first trailer, and I'm really looking forward to this journey that you and I are embarking down together to make a difference. And
Fill the void.
yes, listeners, if you'd like to know more about John and I, please do visit our website at medinsightsunleashed.com. And we look forward to providing you additional episodes over the next few weeks with various international experts from around the world.
Thank you. MedInsights Unleashed disclaimers. This podcast is for general information purposes only and should not be considered healthcare advice in any way. The podcast is not intended to replace professional medical advice. The use of the information and material linked to the podcast is at the user's own risk. MedInsights Unleashed is not responsible for any losses, damages, or liabilities that may arise from the use of the podcast. Importantly, please consult your healthcare provider for individualized guidance and treatment. Thank you, and we look forward to you being with us on the next MedInsights Unleashed podcast.